Episode of Things My Patients Tell Me that I have to take a really deep breath before I answer because I'm livid. Two really interesting stories today. One comes from somebody going to her first 6-week postpartum visit. And I had seen her earlier. Things were looking well. We were just looking at stress urinary incontinence. But she had some questions. So everything apparently looked fine, and she asked about prolapse. And within less than 60 seconds, and this is somebody who maybe had just very, very little anatomical prolapse, no symptoms, by the way. Within less than 60 seconds, the OB was already mentioning surgery, and that pelvic floor physical therapy will not help with this. Again, keep in mind, this is somebody that did not have symptoms of prolapse, was just asking about, do you see any prolapse? And that's where I'm always like, this unfortunately then sends somebody to Google, and then it goes down a fear rabbit hole. And if you've navigated prolapse, you understand this. Like, prolapse is one of those things. It's one of the scariest, most fearful things that a mom can go through, and it can impact your symptoms by having that fear, especially if you have high tone pelvic floor and high sensitivity. And so we spent the first 15 minutes being like, okay, let's unpack what she said. Let me explain to you what's going on. And then we're going to take everything that she said, and then we're going to put it in a tiny little bow and set it over here and never speak of it again. And this is also an OB that she refused to prescribe local topical vaginal estrogen for a lactating mom who's 6 to 8 weeks postpartum with sensitivity on exam. Okay, second one, again, it's that 6-week one. Saw mom after her second delivery, and I said, do you have your postpartum visit scheduled? And she said no, because this is what happened in my first one. And then proceeds to tell me how she literally was not examined. She was having a lot of depression, trauma related to the delivery, was crying, and really didn't want to be there. They didn't acknowledge that there might be concerns about postpartum depression, did not do a physical exam, and sent her on her way. So now this person, second delivery, is like, I don't know why I should go see somebody because they don't know anything. They couldn't even recognize the mental health issues I was having, and they didn't even touch me. So really, what's the point? What are we doing? What are we doing? Like, literally, what are we doing? And so I hear these stories, and then I remember in 2018, ACOG was like, hey, yeah, we need to touch base with people sooner. We need to have conversations sooner. We need to screen out mental health things, postpartum issues. Even before then, I was starting to see moms in postpartum, 2 to 3 weeks postpartum. So I'm like, great, we can help out with this. I barely have moms able to get in with C-sections recovery for a 6-week visit. So talk about healthcare being broken. I almost feel like it's getting worse. And so the ray of light in all of this is it allowed us to have conversations today so that women have an understanding of what's going on with them. They understand the anatomy, they understand the norms surrounding early postpartum weeks. They know that we can have anatomical changes in our body up to a year postpartum. Let's set some expectations up instead of being like, no pelvic floor surgery. What year is this? Are we back in 2000 or what? It's infuriating. So anyway, just so you know, whenever I do hear these things, I take a breath. I say, which version do you want to hear? The filtered and unfiltered version, and then we go from there. So let me know, are you one of those people that you've kind of been told this stuff by your OB, or maybe just like that other client, you literally, no one touched you and said, great, you're fine. Oh, and wouldn't allow babies at the OB visit. Who's got childcare for 6 weeks? Come on. Anyway, if that's happened to you, let me know. I would love to hear about it. Or if you're a provider, if you're hearing these stories, let me know. Would love to hear that.